So glomerulonephritis is a kidney disease. It is a problem of the kidney where the tiny filters in the kidney become inflamed, which means the glomeruli, the filters that filter the water and the other substances and help in the formation of urine, uh, is get inflamed because of the infection, and which leads to ability of the kidneys to filter the waste, and will be affected and leads to excessive fluid from the blood, like excessive loss of fluid, right? So kidneys become more leaky because their permeability will increase. What is permeability? It's the ability to filter the urine, so it will increase, and which leads to leakage of the protein in urine. Usually you will not see your protein in the urine, but in this case, because the permeability is increasing, which is leaking, leading to leakage of protein in urine. So what are the causes of this condition? So mainly the main cause is a strep infection. So if someone has a streptococcal strep throat infection, and we are not treating it, because usually the young kids, they have this strep throat infection often, and if you are not giving them treatment on time, which will be further going into kidneys, and sometimes it will resolve by itself, but if it's a patient has some underlying condition, which it will affect their kidneys more badly. Next is autoimmune diseases like lupus, arthritis. So these are neuropathies. Genetic factors can be the problem. And then history of pharyngitis, tonsillitis, 2 to 3 weeks before onset. So if someone is developing these kidney problems, after having a pharyngitis or tonsillitis, it means that infection further spreads into um, kidney. So what are there are two types of glomerulus nephritis. First one is acute, other one is chronic. So acute is like occurs generally 2 to 3 weeks after the streptococcal infection, and the chronic is may occur after slowly over person is recovered from their other infection of the throat, pharyngitis, tonsillitis. Now after recovering from that, they are developing this slowly over time. So the common problem is that it leads to kidney failure and hypertensive encephalopathy, which is because of the increased level of protein in blood, which will further spread into the brain, azotemia. Then pulmonary edema, heart failure, and seizures. So the sign symptoms will be in main will be, you will see blood in urine, hematuria, protein in urine, proteinuria, hypertension, oliguria, fatigue and weakness, abdominal pain, edema. Edema will be on the facial and the periorbital. In the morning, you will see their face is more edematous, and our periorbital areas around the eyes will be more swollen, and they will be lethargic and paler. People, older kids have headaches, flank or abdominal pain, and then you will see the blood urea nitrogen creatinine level will be going up because of the kidneys are not functioning well. And if you will do their throat culture, you will see the presence of the strep throat anti-streptolysin titer will be there, because it is they are just recovered or they have this infection right now. So diagnosis will be done urine analysis to find out the presence of the blood and urine protein in urine, and kidney function test, and biopsy will be done in further cases. And what will be the treatment in this? So for the treatment, you have to monitor their urine intake, output, vitals, daily weight should be done, and it should be done at same time in same clothes, and activity should be limited because they are lethargic, and diet restriction will be done of sodium depend on the severity, and complications should be monitored, like for kidney failures, no urine output at all. So if someone is having no urine output for more than 4 hours, then it means their kidneys are declining or they are retaining. Diuretics can be administered to help with the edema, like Lasix, to get that water right. Initiates is a precaution to protect them from having any injury. So what happens in this, when patient is having too much of protein, azotemia, those waste in their blood, which is affecting their further affecting their brain, and patient is developing seizure because of those conditions, right? And instruction should be given to the parents if patient is having kids is having throat infection, pharyngitis, laryngitis, skin infection, they should get the treatment right away. And in very few cases we will do dialysis. So weight gain, water gain is the main issues that you want to see. So you will see this. Okay.